Tokyo, under the polished glass walls of Japan's Prime Minister's office, one of the world's most influential philanthropists makes his way inside. Bill Gates, co-founder of Microsoft and chair of the Gates Foundation, has arrived in Tokyo for a meeting of global consequence. His destination, Prime Minister Shigeru Ishiba's office, where discussions on health, innovation and long-term partnerships are set to take center stage. As Gates is ushered inside, Japanese officials follow closely. The setting underscores the formality and the significance of the moment. For Gates, whose philanthropic foundation has spent decades tackling diseases and strengthening health systems worldwide, Japan represents both a partner and a laboratory of innovation. For Ishiba, whose administration has pledged to balance domestic priorities with international leadership, the visit is a chance to affirm Japan's role on the global stage. The two men meet, handshakes exchanged in front of the cameras. Behind the polite gestures lies a deeper symbolism, the bridging of private philanthropy and state policy. Gates brings not only the wealth of one of the world's largest charitable organizations, but also decades of experience navigating the frontier between science and public policy. Ishiba, a relatively new face in the Prime Minister's office, brings Japan's credibility as a technological powerhouse and a nation with a history of global health commitments. In many ways, the images tell the story, a partnership reaffirmed, a dialogue renewed. For both leaders, optics matter. This handshake signals more than just courtesy. It represents shared intent. Both men are acutely aware that the world is facing overlapping crises, from pandemics and health inequities to climate-linked challenges that exacerbate disease. Side by side, Gates and Ishiba pose with officials. Cameras flash, freezing the moment in time. Such images will circle the globe, highlighting not only Gates' continued engagement in Asia, but also Ishiba's willingness to anchor Japan within the broader framework of global cooperation. In a world increasingly divided by geopolitical rivalry, these images project alignment. After the closed-door talks, Gates makes his way toward the waiting press. His foundation has long practiced strategic transparency, using brief but deliberate public statements to signal priorities, highlight partnerships, and pressure governments into action. Reporters lean forward, ready to capture every word. With these words, Gates ties together a web of partnerships. He references the Global Fund, one of the largest financing institutions for HIV, tuberculosis, and malaria, a body to which Japan has been a consistent donor. The mention of innovation taking place in Japan signals admiration not just for policy, but for the country's technological advancements, from cutting-edge vaccine research to medical robotics. Gates points to continuity. The Gates Foundation's work in Japan is not new. It stretches back through years of joint projects, from combating polio to funding research on neglected tropical diseases. What is new is Ishiba's leadership and the reassurance that Japan's government will continue to prioritize health as a central pillar of its foreign policy. The timing of Gates' visit is crucial. The world is still recovering from the aftershocks of the COVID-19 pandemic, which exposed vulnerabilities in even the strongest health systems. Beyond pandemics, older battles persist. Malaria continues to claim hundreds of thousands of lives each year. Tuberculosis resurfaces with drug-resistant strains, and child mortality remains a pressing concern in parts of Africa and South Asia. These are not isolated problems. They are challenges that cross borders, destabilize economies, and test political resilience. Gates Foundation has poured billions into these causes, often filling gaps where governments hesitate. Yet philanthropy alone cannot succeed. The presence of Shigeru Ishiba, representing Japan's government, signals the recognition that sustainable progress requires public-private cooperation. This is what makes the handshake between Gates and Ishiba more than ceremonial. It is a call to shared responsibility. Japan's history in global health is both proud and strategic. As early as the 1960s, Japan invested in overseas medical assistance, linking its technological expertise with its diplomatic ambitions. Over the decades, Tokyo has pledged billions through initiatives such as the Global Fund and Gavi, the Vaccine Alliance. Japan has also championed universal health coverage, promoting the idea that every individual, regardless of wealth, should have access to essential healthcare services. For Japan, this is not just charity. It is a diplomatic tool, strengthening alliances in Asia and beyond. Prime Minister Ishiba inherits this legacy at a time when Japan faces its own domestic health challenges, an ageing population, rising healthcare costs, and the need for innovation in elder care. Yet Ishiba's conversation with Gates suggests that Japan will not turn inward. Instead, Tokyo seeks to expand its role as a hub of medical innovation while continuing to support global health security. For Gates, this meeting marks another chapter in a journey that began decades ago when he shifted from Microsoft boardrooms to humanitarian boardrooms. His foundation, valued at over $50 billion, has become the world's largest private philanthropy. Critics have at times questioned its influence, pointing to the risks of private wealth steering public priorities. Yet supporters argue that Gates has pushed the world toward breakthroughs that might otherwise have taken decades longer. Gates' emphasis on innovation in Japan reflects a keen awareness of where the next breakthroughs may emerge. Japan's leadership in biotechnology, regenerative medicine, and digital health makes it a vital partner. From AI-driven diagnostics to vaccine cold chain logistics, Japanese innovations can help scale solutions not just in Tokyo, but in Lagos, Dhaka, and Lima. This meeting is also a study in soft power. For Gates, philanthropy is diplomacy by other means. For Ishiba, partnership with Gates enhances Japan's image as not only a consumer of innovation, but as a global provider. The optics of the meeting, the handshake, the photo ops, the short statements, are carefully designed. But behind them lies the quiet machinery of policy-making, funding negotiations, and research collaborations that will unfold long after the cameras are gone. As the cameras fade and the officials disperse, what remains is the echo of Gates' words: innovation, partnership, prioritization. In a world where crises often divide nations, moments like this remind us of the possibility of unity, however fragile. Tokyo may only have hosted a brief meeting, but its implications stretch across continents. For children awaiting vaccines, for researchers fighting malaria, for governments navigating pandemics, partnerships like these can mean the difference between setback and progress. Bill Gates and Shigeru Ishiba's meeting in Tokyo is not the conclusion of a story, but the continuation of a long struggle, one fought not only with technology and funding, but with political will. And in that struggle, every handshake matters.
We talked about the work we've done together and the key global health activities with Bobby, with Global Fund, and the kind of innovation taking place in Japan. We talked about the long-time partnership, and he talked about how he prioritizes global health.